The article that I chose to discuss today is about GDV, which is the gastric dilatation and volvus, which is a life-threatening disorder that is most commonly seen in deep-chested dogs, but any dog can be affected. In the early stages, the stomach will fill with gas, and it causes gastric dilatation or bloat. Sometimes, though, the bloat can progress into a GDV or a volvulus, in which the gas-filled stomach will twist upon itself, and it will end up blocking the entrance and the exit of the stomach, which then becomes a life-threatening condition that would require surgery to fix. So when looking at dogs that may present with GDV, you are going to want to take a right lateral or a left lateral and then a dorsoventral radiograph to confirm whether or not the stomach has flipped. And then you want to make sure that this is as low stress as possible, so that the risk for aspiration pneumonia is decreased. You'll typically see a double bubble appearance in the right lateral view, which represents the distended gastric lumen with the pylorus located craniodorsal to the fundus. When these animals present, you want to immediately stabilize with aggressive fluid resuscitation and gastric decompression. So typically what you would want to do is go ahead, place an IV catheter and get some fluids going. You'd also want to decompress the stomach so that it can allow restoration of normal perfusion, and you would do this with an orogastric intubation, or you control CAR, which while fluid therapy is going on. So you would, for the orogastric intubation, you would place the tube you would measure the tube from the tip of the nose to the xiphoid process, and then you would want to lavage the stomach, do a gastric lavage, using a drench pump, which would help to move some of the thicker material. You want to make sure you are kinking it during removal to prevent any material from the tube to enter, so that it doesn't enter into the airway. Again, with this, we are just trying to avoid any aspiration pneumonia. And this is why you want to make sure that you are, it would be better to use an endotracheal tube that is cuffed so that you can further protect the airway during this process. Then you would want to do a gastric trocarization, and this is pretty much, you would use a large gauge IV catheter, and you would place it where the sound is most tympanic when you're checking the side of the body. And then you will hold that catheter in place until the tympanic nature resolves. And at this point, you should see some of those vitals returning to better quality. And then you would want to prep your patient for surgery. First thing when the doctor gets in there is, putting the stomach into the correct position. And then at this point, you want to check for any gastric necrosis, check the spleen, as the spleen can oftentimes be involved with a GDV. And then you'll a lot of times it is recommended to pexy or gastropexy these animals, and that pretty much just creates a permanent adhesion between the body wall in the stomach so that it decreases the risk of a GDV reoccurring. And then you would recover your patient, and hopefully recovery goes smoothly. I chose this article because GDV is something that is seen quite often in emergency, and it does affect, the intestinal system, and it is a life-threatening condition that I think more people should be aware of, especially if they do own these deep-chested breeds, and they should educate themselves on the symptoms and signs of bloat so that hopefully it can be caught early before it turns into the volvulus stage.